But what about the others? What about the, let's say, 95% of the expatriates who do well, fairly well, except that, as we'll see later, they might have other kinds of difficulties. So we walked away from the clinical approach to slowly develop, and we were not the only one. I mean, this is something which is a Western evolution around care for humanitarian workers. So we slowly built what is now called a psychosocial approach. This means that it's not only psychological, meaning it's in the head, but it has to do with the individual that is working in an organization, working in a specific context, in a mission context, with a background, personal background from a country, a specific culture. I mean, the problem with the clinical approach is that it's focusing on not only the individual but also the traumatized individual. But a traumatized individual is also a whole person, and the psychosocial approach definitely addresses the whole person. Today, very quickly, we've come to have a number of projects. We have a big training program. The focus of our work is basically on training expats, training NGOs, training HR departments in NGOs. We have a program here in Geneva of classroom training, and we've also, in the last 4 years, focused a lot on e-learning. We also go to take debriefing mandates after critical incidents. We can debrief people either through email on our website. We have a email support system, field visits, etc. We also have kept an open clinic in Geneva, and we receive distressed expatriates if needed for an individual debriefing and perhaps even a few more sessions of support. We don't do therapy. And actually in our team we don't have a psychiatrist. It's a choice. And we also help NGOs create their own psychosocial support program, because having trainings and upon trainings is not enough. The NGOs need to become aware that they have to have their own in-house program. And I'm very happy this morning to have colleagues here who will explain to you the type of program they have in their own organization. I've just talked a lot about the evolution of the concept behind humanitarian psychology. So let me quickly summarize what I just said. 15 years ago, as I just said, we worked with a mental health approach, psychiatric, medical approach, because humanitarian context involves endemic violence, especially in African countries, which of course can trigger traumatic experiences. What is interesting is that 15 years ago, when we started with humanitarian psychology, we based ourselves a lot on what existed, and what existed at the time was the wealth of knowledge that was accumulated by military psychiatry since the beginning of the 20th century. And I refer you to the first intervention yesterday morning of Mr. Vautravert, who gave us a historical view of the evolution of military psychiatry. But overall, it's based on the idea that people who have strong reactions after critical incident are pathological, which the expatriates translate as crazy, and which would need logically a clinical treatment or medication. So the evolution has come to base itself on the concept of psychosocial support. As I just said, there's a minimal number of PTSD within the expatriate population. And we'll come to that in a minute. Mostly they suffer from cumulative stress and burnout. And this is the various studies that have been done in the last 10 years on the stress of expatriates show that cumulative stress and burnout are the real problem of expats. But the overall concept is based on the belief that we all have resilience in ourselves, and that is not pathological. This is a healing tool that we all have in ourselves. What does resilience mean? It means drawing from personal resources to bounce back after one or many critical incidents, as for expats, or for all of us. It's a way to bounce back after any difficult predicament in our lives. It's about being or becoming stress resistant. Becoming means it's an education. You can educate yourself to become more resilient. It's not something you were born with, but you develop all through your life. Most of us probably have lost dear ones at least once in their lives, and know that that is a big, it's a confrontation with something very difficult to accept sometimes, which is death. It's a shock, and there's a grieving period after, but we have enough resilience, hopefully, to really come out of it strengthened and more mature. This is unfortunately a typical story. We received this email about 5 years ago, amongst many hundreds. As I told you, I thought it was a good story. It had a beginning, a middle, and an end, so you can see the evolution of the person. Hopefully, since then, many organizations have become aware that they just can't send people out there to do the job and get hurt in that particular way without preparation or doing something for them. So, as I mentioned earlier, there are models that have been, programs that have been developed in certain agencies, and later, after going through what kind of stress the expats are subjected to, I'll come to the model that we offer very quickly. So, as you can see, there are many numerous stress factors. Very quickly, of course, the first are difficult life conditions.